bringing you the latest developments on viral outbreaks affecting various regions globally. An outbreak of avian influenza, commonly known as bird flu, has recently affected New York City zoos. The Wildlife Conservation Society reports the deaths of 3 ducks at the Queens Zoo due to the virus. Additionally, 12 birds at the Bronx Zoo have died, with tests underway to confirm if avian influenza is the cause. In response, susceptible bird species have been relocated to protected areas within the parks to minimize exposure. Despite these incidents, the zoos and the New York Aquarium remain open to the public, as the risk to humans is considered minimal. Furthermore, a red-tailed hawk and a great horned owl in the Bronx and Queens have also succumbed to the virus. As a precautionary measure, all live poultry markets in New York City, Long Island, and Westchester County have been temporarily closed for disinfection. This nationwide avian flu outbreak has notably increased egg prices and impacted poultry and dairy herds. Prominent British virologist Wendy Barclay, head of infectious disease at Imperial College London, provides valuable insights into the behavior of avian viruses. She explains that wild avian viruses are continually mixing their genetics, a process she likens to viral sex on steroids. This genetic reassortment increases the potential for these viruses to infect new hosts, including humans. Barclay's research has identified key mutations in the H5N1 bird flu strain that enable it to replicate more efficiently in mammals. While current H5N1 strains lack the necessary mutations for airborne transmission between humans, she warns of the high risk should these changes occur. Preparedness measures, such as vaccine seed strains and antiviral drugs, are in place, but public cooperation in testing and containment would be crucial in managing any potential outbreak. In Alabama, researchers have identified a new virus named the Camp Hill virus, a relative of the deadly Nipah and Hendra viruses. Detected in shrews, this marks the first discovery of such a virus in the United States. Currently, there is no evidence that the Camp Hill virus has infected humans, and scientists assess the risk of human infection as likely low. However, the discovery underscores the importance of ongoing surveillance and research to monitor potential zoonotic threats. Health authorities are monitoring an increase in cases of human metapneumovirus, HMPV, particularly in China and the United Kingdom. In China, detections of seasonal influenza, rhinovirus, RSV, and HMPV have increased, especially in northern provinces. The World Health Organization notes that this rise is within the expected range for the Northern Hemisphere's winter season. In the UK, a slight uptick in HMPV cases has been observed, particularly among children under 5. While HMPV usually causes mild illness similar to a common cold, it can progress to bronchitis or pneumonia, especially in infants and the elderly. Health officials emphasize that HMPV is not new and has been present for decades, distinguishing it from viruses like COVID-19. An outbreak of Oropouche fever began in December 2023, with over 9,852 infections reported, including the first cases outside the Amazon region. While most cases have occurred in Brazil, local transmission has also been reported in Bolivia, Peru, Colombia, and Cuba. Cases among travelers to the region have been identified in the United States and Europe. As of August 16, 2 fatalities were reported, marking the first known deaths caused by Oropouche. The virus is transmitted by biting midges and typically results in mild symptoms such as fever, headache, nausea, and muscle pain. However, severe neurological damage can occur in some cases. No vaccines or treatments currently exist for Oropouche fever. Since September 2023, an epidemic of a new variant of clade IMPOX, called clade 1b, has been ongoing in Central Africa. As of 2024, more than 29,000 cases have been reported, with over 800 fatalities, nearly all in the Democratic Republic of the Congo. The World Health Organization declared the epidemic a public health emergency of international concern on August 14, 2024. The new variant has shown potential for greater ease of spread compared to other MPOX strains, with lesions predominantly on the genitals, making it more difficult to diagnose. No vaccines or treatments currently exist for this variant. Rwanda reported its first ever outbreak of Marburg virus disease in September 2024. The index case is believed to be a 27-year-old man who was exposed to the virus through contact with bats. As of October 30, 2024, Rwanda recorded 66 cases and 15 deaths from Marburg virus disease. The World Health Organization and the Rwandan government declared an end to the outbreak on December 20, 2024, after no new cases were reported in the preceding 42 days. These developments underscore the dynamic nature of viral pathogens and the importance of vigilant monitoring, research, and public health preparedness. Staying informed and adhering to public health guidelines remain crucial in mitigating the impact of these viral threats. Thank you for joining us for this comprehensive update on recent viral outbreaks. Stay safe and informed.